Welcome everyone to this month's webinar, Let's Talk Stigma, sponsored by MERS Therapeutics. My name is Donna Greening, and I'm a Programs and Services Coordinator at Parkinson Canada. I know you're all eager to get started, but I want to go over a few items before we start. From coast to coast, we acknowledge the ancestral and unceded territories of Inuit, Métis, and First Nations peoples. We have enabled closed captioning for the benefit of attendees who may be hearing impaired. You can turn on or off closed captioning on your own screen by clicking on the CC Live Transcript button and then clicking on Show Subtitle or Hide Subtitle. Please note that this feature uses auto transcription, so there might be some spelling errors along the way. At the bottom of your screen, you'll see Q&A and chat buttons. If you have any questions, please write them in the Q&A space. We will have some time at the end to answer some of those questions, as well as the ones that you submitted when you registered. The chat window is there if you want to talk amongst yourselves, but questions written in that chat window will not be seen by our presenter. Now, let's get started. Dr. Soania Mathur is a family physician living outside of Toronto who resigned from her clinical practice 12 years following her diagnosis of young onset Parkinson's disease at the age of 28. She's a dedicated presenter, speaker, educator, Parkinson's advocate, author of 2 children's books about Parkinson's, and creator of Unshakable MD, a platform that offers patient education and serves as an outlet to share her personal experiences with the disease. Dr. Mathur is an active speaker in Canada and internationally and has authored a number of published papers and online pieces that focus on patient education, empowerment, and the importance of involving patients in all areas of clinical research. She serves as co-chair for the Patient Council of the Michael J. Fox Foundation for Parkinson's Research and is also a member of their Executive Science Advisory Board. She's also on the board of directors at the Davis Phinney Foundation, is part of the editorial board for the Journal of Parkinson's Disease, and serves on the Brian Grant Foundation International Science Advisory Council. She was awarded the World Parkinson Coalition Award for Distinguished Contribution to the Parkinson's Community in 2019, and in 2020, she received the Alan Bonander Humanitarian Award for her work in the Parkinson's community. Dr. Mathur sits on the board of directors of the Lakeridge Health Foundation and also sits on the Patient Advisory Council for Toronto Western Hospital's Movement Disorder Clinic, where she chairs the research committee. Recently, Dr. Mathur co-founded the PD Avengers, a self-funded global alliance of Parkinson's advocates dedicated to unifying the global Parkinson's community to add urgency to the areas of wellness, research, and advocacy to end Parkinson's. She will be joined by her daughter, Neha Mathur, a medical student at the Michael G. DeGroote School of Medicine at McMaster University. Inspired by her mother, Neha is involved in Parkinson's disease advocacy with special interest in how it can affect family dynamics and communication with loved ones with Parkinson's. She's covered these topics in previous blogs and webinars. Her emphasis on the need for multidisciplinary and holistic care of the disease has translated into her academic work, as she has pursued research into non-pharmacological management of neuropsychiatric symptoms of Parkinson's. Welcome, Dr. Mathur and Neha.
Thank you very much, Donna. I think that's much too long an introduction. I should probably shorten it to just patient, because that's what I identify the most with. I'd like to sort of start by sharing a few scenarios with you all. Do you recall that look that you get at the grocery store as you lose your balance, knocking something over? Or maybe parents steering their kids away as you freeze in a doorway? That impatient sigh you hear in the lineup behind you as you fumble for change at the register? The invitation that's not extended you by friends because they figured it may be too late for you to go out? The coworker who gets frustrated at having to ask you to repeat yourself once again because you're speaking too softly? Being passed over for a promotion at work when you are actually the most qualified? Unfortunately, too many of us are all too familiar with these kinds of situations or similar situations. As mentioned, my name is Dr. Soania Mathur, and it's my privilege to speak with you about a topic that truly affects all of us living with Parkinson's disease, or any other chronic illness for that matter, and that's stigma. Regardless of our stage of disease, our age, our gender, our ethnicity, where we live, we all experience some degree of stigma and the damage that stigma can inflict. Irving Goffman, I read about him recently, was a Canadian-born sociologist, social psychologist, and writer, considered by some to be the most influential American sociologist of the 20th century. And he wrote one of the earliest contemporary papers on the subject titled Stigma, Notes on the Management of Spoiled Identity. Here he wrote, while a stranger is present before us, evidence can arise of his possessing an attribute that makes him different from others in the category of persons available for him to be, and of a less desirable kind. In the extreme, a person who is quite thoroughly bad or dangerous or weak. He is thus reduced in our minds from a whole and usual person to a tainted, discounted one. Seems like a rather harsh description of a very real problem. We don't use that sort of language anymore, but that's what stigma is. It's the negative attitude that we attach to a characteristic of an individual that may be regarded as mental, physical, or social deficiency. A stigma that implies social disapproval and can lead unfairly to discrimination and actually exclusion of that individual. Though originally classified as a motor disorder, Parkinson's disease, we all know that the burden of this disease extends well beyond the physical movement issues. This disease, as we all can understand, is all-encompassing. It affects us physically, it affects us emotionally, it affects us mentally. And on top of the motor symptoms of tremor, stiffness, slow movements, and imbalance, and the non-motor symptoms that can occur, such as pain and sleep disorder, constipation, urinary effects, drooling, the burden of this disease extends into our self-image, right? Our relationships, our social constructs. And it's a burden that's made even more difficult by stigmatization. As Donna mentioned, there are a few different types of stigma. There's internalized or self-stigma, which refers to those negative attitudes, including internalization of those negative stereotypes that those of us with Parkinson's have about our own condition. It's like a mark of shame that you put on yourself. And those traits that are most disturbing to us include tremor, excessive saliva and drooling, gait disturbances, dyskinesia, freezing, facial masking. That's to name a few. You might have your own personal ones that are particularly bothersome to you. And these are often symptoms that can cause us the most embarrassment. They're difficult to hide. They give away our condition. Disclose some sort of problem, may not be identifiable by many, but regardless of whether we want to share our diagnosis or not, it becomes visible. And these symptoms make us feel self-conscious. As a matter of fact, more than 50% of patients, although I would argue it might even be higher than that, but 50% of patients, at least with Parkinson's disease, conceal their diagnosis, trying to mask some of their clinical symptoms or even avoid appearing in public to avoid what may be thought by them as scrutiny and judgment. I know that's happened to me, but because we feel badly sometimes about our symptoms. And self-stigma or internalized stigma is not only associated with the exterior noticeable symptoms of the disease, but also due to the progressive loss of functioning that we have, loss of self-efficacy and autonomy. Some of us become sort of aware of the awkwardness and sometimes our inability, which is very frustrating, to do not complex work activities only, but even simple motor tasks, which can be devastating, definitely devastating, and affect how we view ourselves. In my particular case, the visible symptoms have not been the main issue for me. Yes, I'm now 24 years into the diagnosis. It's been progressive the whole time, and I have a significant amount of visible tremor and stiffness and bradykinesia and in my off periods, and dyskinesias during many of my on times. But I still respond fairly well to medication if I go out in public for a short period of time, and only my family is actually privy to a lot of my symptoms. But this lack of autonomy and self-efficacy and functionality, that has always been the difficult part for me to work through. You see, my story began a long time ago when I was diagnosed at the age of 28. And despite my protests, my experience was that it felt as though my brain was disengaging from my body, lessening my control. The tremor that started in my right pinky finger soon moved into my right arm and my left arm, and then my right foot, and then my left foot. Stiffened my body in the morning, cramping my feet to the point of being unable to walk. Amplified my tremor, caused a lot of pain, turned my nights into restless exhaustion because of my sleeping difficulties, and there was no escaping it. I mourned the day that I had to give up assisting in the operating room and suturing in our urgent care because I felt I couldn't do it anymore. I hated the fact that I had to time my medication so that my hands would not be shaking and noticeable when I gave immunizations or something simple like taking a blood pressure. And it infuriated me that the tremor would give me an air of nervousness. It made me question, my symptoms did. At times, was I still able to do my job? And relentlessly, the same questioning followed me into all aspects of my life, from caring for my young children to taking care of my home, to my relationships with friends and family. So it was a feeling of not being capable enough, of being disabled. Those negative attitudes and stereotypes that I internalized of being less than was something I struggled with probably for a very long time. But thankfully, through a lot of introspection, that time has passed for now. And I probably, as Neha may attest, swung the other way and pushed myself to do a little bit more than maybe I should or can. Now, an interesting quote I came across is Michael J. Fox, who once said, "Now I feel and I say all the time that vanity is like long gone. I'm really free of worrying about what I look like because it's out of my shaky hands. I don't control it, so why would I waste 1 second of my life worrying about it?" Now, that's an accurate statement. It's a very brave statement. But most of us, including myself, are not there in our outlook yet. And many of us with PD employ strategies. We try and hide our symptoms from being seen in public. How many of you have sat on your hands or hooked your foot on the chair of the leg of a chair to prevent a tremors or dyskinesias from being visible? I used that as a coping strategy for a long number of years and continue to do so. The stigma that we experience may be based on others' reactions to those symptoms that we show that we can't hide, or in ourselves with our own fears of others' reactions. The stigma that is actually based on others' reactions is what we can call social stigma, which again is a disapproval of or discrimination against an individual or group of individuals based on those characteristics that we can perceive that distinguish them from other members of the society. And that risk of stigmatization becomes greater as the visible symptoms of our disease become worse. Those elements cannot be hidden any longer. They're revealed to the public. Parkinson's symptoms such as balance or gait issues may be mistaken for other stigmatized conditions such as drunkenness or drug use. Difficulties in speech and communication or drooling may be mistaken for intellectual disability. A masked face may be interpreted by someone as being unemotional or uncaring. And all of these misjudgments may lead those of us that have been subjected and experienced these accusations. And many, I myself have not personally experienced a lot of them, but I certainly have friends and fellow members of this community that do, they socially isolate themselves and withdraw, which has really a negative impact on our quality of life. As I said, I've been lucky to have been exposed not to that much scrutiny by the public, although I certainly have felt it at times being treated differently when I'm off versus on. I do a lot of scientific meetings, and in that situation with the knowledgeable researchers and clinicians that are around me, when my tremor voice is off, I think it causes people to believe I'm nervous or ill-prepared. When I'm off, people do look at me inquisitively. I can tell people frequently think I'm nervous or that I can't handle stress, or I won't be asked to do physical things, be it a hike or some other activity, because people assume I'm not capable. The last type of stigma I want to mention is institutional stigma. It's more systemic. It involves policies of government and private organizations that intentionally or unintentionally limit those opportunities for people with conditions like Parkinson's disease. As a physician, I wasn't exposed to a lot of institutional stigma in terms of my place of work. But having been said, a lot of companies really aren't set up to allow doctors with disabilities, or anyone, with disabilities, to continue in those areas that they are performing in currently. Certainly, the medical system isn't set up for doctors with disabilities to perform in a modified practice or reduced hours, for instance. A lot of other examples of institutional stigma might be lower funding for research or fewer community health services directed towards Parkinson's care relative to other health conditions. I want to share with you now an interesting study that looked at the predictors of self-stigma in Parkinson's disease. In this study, they looked at over 350 people with PD, and they evaluated their quality of life using, and some of you may have filled this out before, the PDQ-39 questionnaire. It looks at quality of life in people with Parkinson's. So they used that. They used the motor symptoms questionnaire, as well as how people functioned with regards to their activities of daily living, their daily life. And they also evaluated their mood. The questions that centered around stigma were questions like, have you felt you have had to hide your Parkinson's from people? Have you avoided situations where you had to eat or drink in public? Were you worried about people's reaction to you? Were you embarrassed to be out in public, for instance? When they analyzed that data, once they collected it all, they found that self-perceived or internalized stigma was predicted by younger age and a greater depression severity. Now, that means that people that had high stigma perception were often younger and had greater depression. The prediction by depression held for both men and women, whereas the prediction for age was specific to men. I don't know why that may be, perhaps because of the perceived occupational or family pressures that men may potentially feel, particularly when they're diagnosed at a younger age. Again, I'm not sure. But for both men and women, as depression increased, the relationship between PD and stigma strengthened. This finding is kind of in line with work that's been done by many people that has recognized depression as it's very prevalent in our community, and a significant contributor to quality of life issues in Parkinson's disease. It also works the other way around, where stigma isolates and marginalizes Parkinson's patients, leading to increased depression and other mental health issues, such as anxiety, which ultimately decreases quality of life. So there's that deep interconnection between symptoms of Parkinson's disease, stigma, depression, and poor quality of life. So it's a significant problem and one we don't talk enough about. I hope to do that today. But how do we approach this problem? Well, it really needs to be approached on an individual and a societal level. And at this time, I'm going to ask Neha to join in on this part of the discussion. Based on her paper, I want to know, Neha, if you have any thoughts on how the individual can approach this challenge of stigma.
Yeah, so as you kind of went over, there's a big connection between more psychiatric symptoms of Parkinson's, like depression and anxiety, and especially self-stigma that one might feel about themselves. And I just want to kind of go over some general coping strategies and mechanisms that might be helpful in allowing one to reduce that self-stigma or anxiety surrounding certain symptoms or your perceived nature in society. A few things that my research found might be helpful in terms of anxiety and depression are focusing on self-reflection based therapies like mindfulness, psychotherapies, and other mind-body exercises that allow you to look inwards, reflect on yourself while also engaging your body, such as Tai Chi, yoga, even dance classes, or breathing techniques. These can all be used not only to alleviate physical symptoms, but also those more emotional symptoms like anxiety and depression, all of which have strong interconnectedness with self-stigma and perceived stigma from society. In general, all these approaches work best when one is engaged in their self-management, and also work best when an education-based approach is taken, where the individual really understands how these coping mechanisms can help them and how to best integrate them into their daily lives. But in general, the best way to help reduce stigma is education, not only for oneself to help them through self-stigma, but education on a more societal level as well, to reduce the general stigma in society against some of these more physical symptoms. So just to kind of summarize again, things like mindfulness, psychotherapy, breathing techniques and mind-body exercises were all shown to help reduce anxiety and depression within Parkinson's, which has that strong interconnectedness with self-stigma.
Thank you, Neha. That was great. That's a totally objective opinion. In that same study, Neha described some coping techniques that were really do help with dealing with emotional effects of stigma, or the mental effects that it can incur. In that same study that I mentioned a few minutes ago, they looked at those symptoms that patients were experiencing and that experience of stigma, and their findings suggested the motor symptoms and their impact on daily life really were not, they contributed, of course, to the experience of stigma, but it was really more the experience of depression. And this suggests that this treatments focused entirely on alleviating motor symptoms through medications and so forth don't target the PD emotional response will not really help alleviate the stigma perception. So although the motor symptoms and limitations of PD are often a major focus of diagnosis and treatment, targeting motor dysfunction alone without targeting mood disturbances could be really a major disservice to individuals with PD who experience stigma. So along with what Neha mentioned, on an individual level, physicians too must ask not only about physical symptoms, but about psychosocial issues. And if it's not physician initiated, then we as patients must feel empowered enough to bring these issues to the attention of our medical team. And again, as Neha mentioned, the population level, we have a lot of use of social media and the internet. It is possible to launch these anti-stigma campaigns to combat stigma, and as she mentioned as well, improve the general education about this disease. So it's up to us as a community to empower ourselves to find ways to cope with and battle the effects of stigma that we put on ourselves, or find ways of educating others to lead to greater understanding of our illness, thereby reducing societal stigma. Ultimately, this will all lead to an improvement in our quality of life and our life experience, because until there's a cure, it really is all about quality of life. Thank you. And Donna.
Thank you so much, Dr. Mathur and Neha. That was really interesting hearing how the interconnectedness of the person who has Parkinson's, their physical symptoms, their emotions, their quality of life, and the type of treatment that they get, and how that all plays together to help someone, or to negatively impact how their quality of life is. So that's really, really interesting. We're now going to move on to a panel discussion. And joining Dr. Mathur and Neha now are Brock Carlton and Lydia Anderson. Brock Carlton retired in 2020 after 13 years as a CEO, leading a staff of 250 and a united membership of 2,000 cities across Canada. Prior to his role as CEO, Brock's work of building strong municipal management, environmental sustainability, and good governance led him to working in places such as Gaza, the Czech Republic, and East and Southern Africa. He's lived in Kenya, China, and Namibia. Brock was diagnosed with Parkinson's disease in September 2020, having been previously misdiagnosed with essential tremor. In retirement, Brock enjoys an active lifestyle, skiing, canoeing, hiking, and cycling, and spending time with his family. Brock's a volunteer for Parkinson Canada in our ambassador program. Lydia Anderson graduated from the University of Ottawa with a degree in commerce, with a split major of marketing and entrepreneurial studies. She and her husband are the proud parents of 3 girls and 1 boy. Both parents work from home full-time while juggling all of their family responsibilities. Lydia and her sister are care partners for both of their parents. Her father has advanced Parkinson's and is living in a long-term care facility with additional private help, and their mother is recovering from an ischemic stroke while living in an assisted care retirement home. Her days are hectic and busy as she strives to find balance and happiness in the little moments. She has a deep understanding of the challenges that stigma have presented to both her dad as he navigates his way through the changes that Parkinson's has presented in his life, and to herself as she cares and advocates for him and for the rest of her family. Welcome to the panel, Brock and Lydia. Let's start with Brock. Brock, how long after your Parkinson's diagnosis did you tell your family, friends, and neighbors? And what drove the decision to talk about it when you did?
Yeah, thanks for that. It took me several weeks, and some of that was to get informed about what I was dealing with. Some of it was to kind of get over the shock and try and manage the emotions of the reality of the situation. But a lot of it was driven by fear of being seen as less than. You know, Sonia talked about this in her presentation. The fear of being less than, the fear of being less seen as less vital force in life, the fear of feeling less relevant in relationships and the things that you're trying to accomplish. And so all of that self-stigmatization really held me back from sharing the news until I could get a handle on it a bit more readily.
Okay. And when you finally did share with the people that were closer to you, were their reactions what you anticipated?
Yeah, the reactions varied, and it varied. I was, in retrospect, there's kind of two factors that I think affected the way people reacted. One was everyone seems to have some connection to Parkinson's. They know somebody, they've heard of somebody, they know a little bit about the disease. So that seems to have an impact on the reaction. But I think more importantly was the way I presented the issue to them. If I was emotional, if I was stressed, if I was portraying a victim stance, I think people were uncomfortable. People were disconnected. People were, provided sympathy, but no real connection. Whereas as I progressed in the telling of my story, I became much more matter of fact, and I felt that it helped people regulate their own emotions, and so they were more open, more empathic to my situation. I was, just as a way of example, I was in late March. I was going up to a backcountry ski lodge in the Rockies. And so we were in a helicopter, and we were all decked out to ski with helmets and ski boots and all this stuff. And there was 8 of us in the helicopter. I didn't know any of these people. But before the engine started up, it was quiet. So I said, I'm Brock from Ottawa, and you've noticed I have this shake in my hand. I have Parkinson's, and it's okay. It's okay to talk about it. It's okay to think about it. I have no idea how my Parkinson's is going to affect my skiing this week. I don't know what's going to happen, but whatever happens, I'm okay with that. And it just set the tone for the whole week, so that people were curious, people were empathetic, and it just made life a lot easier than had I tried to hide it, for example, and people would wonder, well, what's going on with that guy?
Right. So what I'm hearing you say is that the way that you presented your news impacted how others viewed you as a person living with Parkinson's disease. Am I right?
Oh, absolutely. I think it's really important that the way you present it is really important, because people pick up signals on the way you're presenting, and that affects the way they react to the news.
Mhm. So that weekend that you were away skiing, and I know that you're very athletic, how did you manage your skiing that week, and how did that work with you being with a group of people?
Well, it was an exercise in learning my new limitations.
Hmm.
Because I got up on a mountain slope, and I couldn't get my body to do what I knew I had to do to get down that mountain slope. I couldn't do the subtle movements. I couldn't do the quick shifts of weight, and I just couldn't do it. So all of a sudden, after having been a skier for 60 some odd years, I can't ski downhill. And so I ended up snowshoeing and having a wonderful week. But I was able to relate to what everyone else was going through, because I'd been there before. I'd done that, but I was also able to accept that I have these limitations. So I find now when I cross-country ski or when I cycle, I'm much slower. Got less endurance, less strength, and I tend to pull back. I tend to do these things more on my own, which is absolutely the wrong thing to do, because it breaks this connection. It breaks connection with friends who like to do those things with me. It doesn't give them the opportunity to celebrate my continued level of activity in the face of this disease. And it doesn't break down the stigma, the social stigma, because it doesn't educate people that I, as a Parkinson's patient, individual with Parkinson's, can still do these things. So it's intellectually, I know this, but I haven't quite gotten over the emotional energy to say, okay, it's going to be okay if they have to wait for me at the top of the hill when
Right,
I'm skiing, or if I'm cycling, they're going to have to wait for me. But that's just part of the new reality.
right. I guess as you learn to do things differently, those around you can also learn to do things differently with you as well.
Yeah, for sure. I mean, just the fact that I don't cycle as fast as my friends cycle, so I can't keep up with them. So they wait for me at the top of the hill, or they go slower so we can talk while we're cycling.
Mhm.
Or you find an alternative strategy, and I rent an e-bike. then I can keep up with him.
Right. It's great to make those adjustments. Well, thank you for sharing that. Now I'm going to ask Lydia, as a care partner, when your father's symptoms initially became harder to manage, for a while, I know that your dad lived with your family before he moved into a care facility. Through those moves, how did your relationship change, and the way that maybe that you communicated? How did that change?
Dramatically, I would say. About 5 years, 6 years after his diagnosis, he said to me, you know, I don't think I can live alone anymore. So we uprooted our family. We moved in with Dad, and it was actually really great for the first few years. Dad only had a couple of different, you know, little things that were different about him, if you will, due to the Parkinson's. But I definitely had very little awareness of Parkinson's, the stigmas associated myself, admittedly. And I know that I am responsible for some of those stigmas with Dad. You know, what's taking you so long? I need to get to the coffee first thing in the morning, or whatever it is. So I can definitely appreciate the conversation about stigma, and then my journey myself in terms of understanding what was happening. You know, it changed quite a bit. One of the examples that I remember is when we first moved in, I started taking over some of the different tasks for Dad. And one of the tasks, I started looking at his financial situation and that kind of thing. And I realized, I said, Dad, you have a pension here that you should be collecting for like the last 8 years. What happened? And he said, yeah, I know, I keep meaning to get to that. You know, and he had his papers all organized. And in my head, I'm like, this is just like lazy. How are you retired? How are you not doing this? And it took me a really long time. It wasn't until years later that I realized this has to do with the motivation, the executive functioning and planning for Dad. He just couldn't do it. He would admit to me, he's like, you know, I really try. I sometimes get started and I can't finish. And I thought, you know, my father's been a very intelligent man his whole life, known for his intelligence. And it was shocking to me. And again, when you don't live with a parent, and my parents are split up, so there wasn't a person living with him, you don't notice any of these things. So once I moved in, there was this huge awareness of kind of what had been going on for the couple years before. And so again, we lived together for a few years, and then my father had a health problem, which we thought was Parkinson's, that ended him into a spinal surgery. So at that time, he left our home, and he was in hospital for several months. And then once he had recovered, the recommendation was that he needed more care and that we probably couldn't take it on at home. That was very difficult, moving Dad, especially he's lived in this house for like 40 years. Very, very, very hard to take him out of this surroundings, but also knowing that I couldn't manage him. I have a special needs son, and I have two other children and a teenager. So it was just, yeah. Once he moved into a care facility, things started to change quite a bit. Not being the primary caregiver allowed me to, breathe, for starters, and really take a step back and start to be able to understand what was happening with Dad, attend his appointments with the neurologist so that I could hear firsthand what was happening with Dad, because I really had very little knowledge of Parkinson's. So as time went on, our relationship changed quite a bit. Towards the end of him living here, our relationship was fairly negative. It was very stressful. But once we were able to get him care, and I was able to be his daughter again, and his care partner, but his advocate, our relationship changed very much. He was able to have empathy for me and worry that I was doing too much, and be my dad again. So I feel really lucky that we are able to have that relationship still, because it definitely went away for quite a long time.
Right. And I guess also having that time freed up where you could focus on your own your own life as well and being able to foster that parent-child relationship, I'm assuming that also gave you more energy and opportunities to educate the healthcare professionals who are now working with your dad on a daily basis. And how did that impact his quality of life?
Definitely helps. And actually Brock made a really good point. Your attitude about things makes a huge difference to how things are perceived. So I've always made a very conscious effort in front of his care providers to explain that this is normal, that this is okay. In the instance where he was not able to, and the good thing is he allows me to speak for him on his behalf. And you know, over time, I think he's even a little proud that I'm saying the right things, that I'm understanding actually how it works. Yeah, so, you know, yes, I definitely have had more time. We've done some training, some Parkinson's training, you know, with the home that he's with right now, which helps. But the turnover is it's different when you're in long-term care. It's difficult to have everyone be sort of educated at the same time. The areas that have been super helpful for us have been the geriatric psychiatry team. They're amazing. They understand, they have compassion. Their involvement, I think, has really helped.
Okay, thank you. Neha, you were born after your mom's diagnosis, so you've grown up having a parent with Parkinson's. How did your friends at school react, and how do you think those experiences can help us all destigmatize Parkinson's?
I think that's a great question, because I think we can really learn a lot in some ways by how kids react to these kinds of diagnoses that are brought up. And I found generally kids are quite naturally accepting unless they've learned to be otherwise from other individuals. So most of the time we didn't have any trouble with it at all, especially because most people in our community really got to know my mother quite well. Regardless, she was the most active mom a mom can be in their child's life, showing up to every bake sale and every birthday party and every sporting event that she could. So people got to know her for who she was as a mother and who she was as a doctor in our community, and all that she could offer from that perspective. So yeah, maybe a kid would notice, hey, she's handing out the orange slices a little bit more slowly than other moms at the soccer game, but she handed out the orange slices all the same. So even if someone would ask, oh, is your mom okay? Oh, I noticed your mom is shaking. And I would just say, oh, she has Parkinson's disease. That's usually where it ended. And that was that. If they had more questions, they asked more questions. And it was always in a nature that was purely curious with no other ulterior motives. And I think maybe these are general principles that we can take when it comes to destigmatizing Parkinson's. One, from the perspective of my mom and myself and our family in general, being open about talking about it, about being willing to answer any questions that anyone might have, but also from the perspective of, you know, the kids I grew up with and the students in my class and whatnot, of not going into it with any preconceived notions, just meeting my mom, learning about her for her, and asking questions when they needed to ask questions, and leaving it at that.
Great. So Dr. Mathur, you mentioned that you were still working when you were diagnosed, and I know you waited a while to reveal to your colleagues, but can you share a bit more about that experience, about when you did share your diagnosis with your colleagues and or any patients, and what went into that decision to let others know?
Sure. First of all, Neha, I miss those orange slice days. They were a lot of fun. I was working at that time, and my decision not to disclose was very much because of internalized stigma and the fear of societal stigma. I was very much afraid that my patients would look at me differently, think I wasn't as capable of doing my job, that my workers, the other physicians in the practice might also view me as being less capable. So I actually am a very slow learner. I hit it for a good 10 to 12 years. That's how long I was in clinical practice, except for my direct partner who knew about it. And that's also extended to my social. I mean, basically who knew were very close family members, my husband, my kids, that's about it. But when I disclosed, because I could no longer hide it, it was just the symptoms were so obvious. When I disclosed, I actually was surprised. It wasn't quite the pity party that I thought it was going to be. It was actually an outpouring of support. I agree wholeheartedly with Brock that it depends on your delivery in terms of what reaction you're going to get. And I felt a burden that was lifted that I didn't actually know existed in the first place until I disclosed. Of course, people react differently. My co-workers and my patients were very understanding, sad that I had to close my practice, but it was at the right time to do that. And friends reacted fairly supportive, very supportive, actually. Some were, of course, more upset than I was, because that's just the type of people they are. Some people kind of didn't really feel comfortable with the situation, but the overwhelming response was of support. And but that's a very personal decision. It really depends on your life situation, your environment, your social group, your family, your work, to decide when to disclose. I think it's a unique decision for everyone to make on their own.
So what I think I'm hearing you say is that this, a lot of what goes into that decision on a personal level is that you have to get over that feeling that maybe that you might be perceived as less than. Am I right?
Yes, absolutely.
Right. So Lydia, I know that you've seen firsthand how changes to your dad's abilities have impacted how your dad views himself, maybe in the same type of way, as an independent person living with Parkinson's. What does your dad express to you about his own sense of self as he experiences some of those changes in his physical abilities and some cognitive changes?
Sure. Well, earlier on, his cognitive, I would say his cognitive being was great. I didn't see anything, maybe a little bit of maybe some depression and anxiety, but his physical symptoms were far more obvious, if you will. So there was a period of time where, dad was retired. I was super busy. He would do the Costco runs. And that was good. Dad wanted to feel like some purpose and like that he was contributing, because he's always been a contributor. But then it got to the point where sometimes I was like, well, I don't know if you should be driving anymore, Dad. Because what would happen is, for those who understand Parkinson's, there's like that point when you start to come down. And the earlier in your process in your diagnosis, the more time you have to take a pill, to react, to do something. But as you progress, that time is much more shortened. So you might be at Costco and start coming down, and it's too late by the time you get home, and you're already dyskinesic. You're kind of all over the road. So losing his license was a hard one for us to work with him on, just for safety purposes, not being able to predict when he was going to come down sometimes. Now, more recently, my father has advanced quite a bit. The cognitive piece is the more stressful piece for Dad. As I said, he is a super intelligent man, and the inability to do things that he used to be able to do is frustrating for him. He's always been kind of a techie and known about, the latest in technology. And now he like brings me his phone and he says, I don't know how I can't figure this out, but I just can't get to my contacts or something. And that's hard for him because he sees that that's happening. And he sees that he's losing that cognitive ability that he's really just been proud of his whole life. And the other piece for Dad is he's had some, we'll call them episodes, like behavioral episodes, that we've tried to understand and tried to explain. The best way to explain it from the geriatric psychiatrist is it has to do with the frontal lobe and the inability to kind of filter your behavior sometimes. So you might just act out how you're feeling instead of thinking, wait, is this appropriate or not appropriate? And then, if it's not appropriate, oftentimes he has difficulty with the reaction of other people, because it's really not him. It's not, that's not his, he's a wonderful man, so when he does something that seems kind of out of character, it's hard for him to, especially when he doesn't remember, hear about it afterwards and be like, oh my goodness. So that's a scary one for him too.
So when that happens, I know that you've said that he feels embarrassed, and because of the reactions of the staff at the facility where he lives.
Yeah.
So I guess education would play a huge role in that, and how they would react to when he may have an episode, or when he's having gait issues or freezing or difficulties, because I know you've said before that he was really into doing hobbies and crafts, and
Oh,
had all of those things around him, and losing those abilities. All of that combined can make some of the interactions that he has with the people who don't understand, who are around him every day, they can make them make him feel like he's being treated as lesser than.
absolutely. Especially in long-term care, because safety is usually their first kind of priority. So dad isn't allowed to have any of his tools anymore in his room. He can't tinker with things. Like he loved to fix like a clock. If it was broken, that would be super fun for him to fix. But he's not allowed to keep those things because he needs to be supervised in those kinds of, for his own safety. But it doesn't take away from the fact that you've removed something that he loves from his life. So it's difficult. And the other piece that's difficult with dad, especially, and I don't know everyone's case. I feel like Parkinson's is very, very much a spectrum type of disease, and it looks different, very different from person to person. But for dad, I think it's been hard for people to see that sometimes he is completely cognitively sound. We have a fantastic conversation. He has this full memory to he's completely off and can do absolutely nothing. So I think a lot of people have difficulty understanding that there's such a variance day to day, hour to hour, sometimes minute to minute, of how differently he can interact and stuff. So I know that stigma came up at the beginning, and that's a hard one. And when I hear it, it kind of grates at me now when I hear someone come in and say, well, you could do that 20 minutes ago. Well, it's not 20 minutes ago. Now dad is off and he can't do it, and they need you to help him, you know?
hmm Yeah, I think the fluctuations is really hard for people who don't have any knowledge of Parkinson's to really understand that there really are fluctuations from hour to hour or minute to minute.
Mhm.
Absolutely. Now, Dr. Mathur, you've said that you want to change the face of Parkinson's with your advocacy work. Can you explain what you mean by that?
Sure, Donna. Um, Basically, I think that we have, or the public has a perception of what Parkinson's is, but we need to sort of educate them that there really are no boundaries for this disease in terms of age, gender, ethnicity, geographic boundaries, political boundaries. This disease can affect anyone at any point in their lives. So that's one thing I hope will change. The other is that this is a very pervasive disease. It's not just a motor disease, it's a non-motor disease as well. It can affect everything from your eyesight to your cognition, to your mood, to your bowel, to your bladder, to pain, to sleep. It's just a very pervasive disease. It affects us physically, emotionally, mentally, socially. So it's a whole body disease as opposed to just a motor disease. And the other two things you and Lydia were kind enough to point out, and that's the uniqueness of this disease. It affects us all differently. It depends, in terms of our prognosis, our symptoms, how we respond to medications and so forth. And it also is a very variable disease. And that's a very frustrating part. As Lydia mentioned, sometimes you can do one thing and then 20 minutes later, you can't do it at all. So that variability really needs to be addressed, because as there was in the comment section, I believe someone was saying that, people don't understand because you look so good that you have Parkinson's disease, but they may not understand that you couldn't get out of bed half an hour ago. You're just waiting for your medications to kick in. So these are sort of some of the aspects that I hope will change in terms of engaging the public and educating them.
Great, thank you very much. Brock, I've got a question for you. So when you were working and you were diagnosed with essential tremor, and then after you retired, you were diagnosed with Parkinson's disease. How did that diagnosis affect the way you felt about your decision to retire when you did, if at all?
Well, it reinforced that I was really glad to be retired. I was listening to Sonia talk about her journey of revealing in her professional context, and thinking, I didn't have to deal with any of that. I didn't have to deal with the concern about being seen as less than. I was the CEO. I was the face of the organization. I was a leader of this staff team and all these mayors across the country. I'm 6'5". I'm a very physical presence. but it would become I was a fear of diminishment with the tremor in particular. So, and also I find that I no longer have any interest in the levels of stress and energy output that I lived in a professional life. So it was very, I mean, I don't say it was a good thing by any stretch, but I was certainly pleased that I didn't have to deal with that big diagnosis while I was working.
Mhm. Yeah, and I know that your job was, as you said, being the face of the organization. So, as we learn about Parkinson's, we know that stress will affect your symptoms negatively as well. So it sounds like you made the right decision at the right time for you. So that's really wonderful. I'm wondering though, did your professional career impact your decision to become a Parkinson Canada ambassador? And how do you see this new role and how it can impact how others view about Parkinson's and what they know about it and the skills that you can bring to the table?
Yeah, for sure. My career had a huge impact on joining the ambassador program. I mean, I spent a lot of my last many years of my career in very active in government relations and in advocacy work, policy development related to municipal issues, not health issues, but still it's all the same similar process. So I have developed all this skill and this experience. And when I left FCM, I was thinking, okay, I have all this skill. How do I mobilize that skill to continue to benefit society? And then I just, with me being diagnosed with Parkinson's, it became obvious I could bring that skill set in a very personal way to advance the awareness and knowledge and hopefully the policy discussions in the federal government on Parkinson's, all in the hope of benefiting people with Parkinson's across the country.
Mhm. Dr. Mathur, you're co-founder of the PD Avengers, and Brock, you're now a Parkinson Canada ambassador. So even though you've both grown so much in how you view and talk about having Parkinson's, are there still moments when you feel overwhelmed or weighed down by the stigma? And when that happens, how do you react and how do you get yourself to a better place? Dr. Mathur, did you want to go first?
Yes, sure. And yes, to the answer to the question is yes, I do. And that's because this is a progressive disease. So what I may have felt, 20 years ago, I'm certainly not feeling now. So as this disease progresses, I am challenged by my internalized stigma that I experience. And I kind of go back to the basics for me, which is knowing that optimism is a choice, that I can choose to be optimistic rather than pessimistic. It's not an easy choice, but it's a choice nevertheless. I look to focus on the abilities that I have rather than the abilities that I've lost. Again, trying to remain in the present and really choosing to focus on that day, not fear the future, because that often will get you feeling really quite overwhelmed and down. So just going back to those basics, through some introspection and quiet time, I sort of am able to kind of maneuver my way out of that feeling of stigma, but certainly it happens. And it's a natural part of this disease. You just have to learn the coping skills so you can deal with it when it does come up.
Yeah, and I'm sure those coping skills are different for every person. So Brock, what about you?
Yeah, I notice it particularly in social situations. And now that we're kind of coming out of COVID restrictions, there are more receptions and moments when I'm in social situations. And I do notice that I feel uncomfortable. And I notice myself withdrawing. And then I say to myself, no, this is exactly the stereotype of Parkinson's, is someone who withdraws and disengages. So then I kind of try and come back in, although it's awkward sometimes because I feel like I'm almost forcing my way into conversations in order to overcome the stigma that is so prevalent. But I agree with Soania. You got to make a very personal choice, a very deliberate choice. And I always, as much as possible, try to choose gratitude over being a victim.
Mm.
Gratitude for what I was able to do and the memories and those great memories of what I am capable of doing. Gratitude for what I can do and how I connect with people who still like to do those things. And with gratitude, you open up your heart to other strategies. So you find different ways to accomplish some of the things that you really enjoyed, or the qualities that you really enjoyed about some of the activities that are now difficult to do.
That's a really great attitude. We can all learn from that. Neha, can you share your thoughts on balancing your desire to help your mom when she might be facing some challenges versus what your mom might need or want at the time?
Yeah, I can definitely speak to that. Kind of communication surrounding that was a relatively new thing that our family kind of worked through. Since I moved back home for the first year or so of the pandemic, it was really the first time we'd all been living under the same roof as adults. So there were definitely more conflicts there than we had originally realized. And I think a lot of it came down to not yet having an open line of communication when it surrounded all the complexities of Parkinson's. I think when we talked about it when we were kids, and our general understanding was, oh, mom has shaky hands. But when you are able to connect and kind of understand at a deeper level, as an adult, you really see all the ways it can impact her, whether it is those physical symptoms, but also her own personal self-doubt and self-stigma and things that, you know, she needed to work through and we needed to work through as a family from there. So I think, you know, one of the biggest examples is if she's doing some sort of chore like the dishes or folding laundry or something like that, and me or one of my sisters wanted to take over, you know, if she's in an off period or something like that, it might be helping her physically, but it may not be exactly what she needs in that moment. Maybe in that moment, doing the dishes and being able to complete the task actually would allow her to work through some of those self-doubts and self-stigmas and you know, other motivations behind why she'd need that. And so being able to have an open line of communication surrounding that, so we better understood that, was really key to working through some of those difficulties. Because, you know, it's not, I talked earlier about not making assumptions and kind of going in with an open mind, but then we would be making those same assumptions, as hypocritical as it may sound, but, you know, you don't really understand that until you ask and you listen and you talk about it. So I think starting that open line of communication was key there to understanding what she actually needed in that moment versus what we may assume she needs.
Yeah, and that's really great insight, because you've grown up with your mom having Parkinson's, and even you still have to do that self-check about what your assumptions are in that moment.
Yeah, definitely.
Yeah. So I've got one question that I'd like each of you to think about and answer. If you could tell yourself your younger self, one thing about dealing with Parkinson's stigma, what would you say to your younger self? Because you've grown so much in dealing with stigma, what would you say to your younger self? Why don't we go with Neha?
I guess I would just kind of reiterate my last point of ask and listen and really have an open mind, because you never really know what that person needs in any given moment. And kind of playing off of what others have said, is it's very individual, very different for every person, and very different moment to moment. So being able to ask and listen really helps build strong relationships.
Thank you. Brock.
Yeah, I've spoken about not being a victim of choosing gratitude, but I think the one thing I would say is, don't, as much as possible, don't let Parkinson's define who you are. You define yourself, who you are, and manage the Parkinson's around that self-definition. Now, that may be a bit naive because my symptoms aren't that progressed yet, but that's what I would say at this stage.
That's great. Lydia.
I think what I would tell myself is and this is a tough one, but to just learn about it, be more aware, be open to it. I knew about my father's diagnosis way before I was involved in it. And again, that's part of being the child, because until you're involved, you're not involved because your parent can take care of themselves. But I wish I had, you know, even just taken, Dad's a pretty, he's a very introverted guy, but I wish I'd taken him to like support groups. I wish I had exposed him to other folks with Parkinson's. I think it would have helped him. So just that openness for him, and he needs a bit more of a push. So if I went with him, he would have come.
Yeah, that's a really great point. Having that support is so key to helping not stigmatize yourself. So that's a really great point. Thank you, Lydia. How about you, Dr. Mathur?
I think what I would say when it comes to facing the challenges that stigma presents is, don't take it personally. It's hard not to, but it's important not to, because it really reflects more of a lack of education of those around you than anything else. So concentrate on yourself, your own journey, concentrate on making sure that you do self-care, that you educate yourself, that you focus on your quality of life goals, because only you know how they can be reached. So choosing to focus on the present, focus on your abilities, I think is really important. And also take advantage of the times that you do face stigma as an opportunity, as you mentioned, to educate others. Because it's really through education of ourselves, our medical team, our families, our communities, that's really going to end up helping us overcome the effects of stigma.
Right. Well, thank you so much, Dr. Mathur, Neha, Brock, and Lydia, for sharing your stories and insight about stigma. I know we're a little short on time, but we are going to take a few questions for the panelists to answer, questions that have been submitted by our attendees today. One of them is I noticed when I was first diagnosed with Parkinson's, I had been losing interest in associating with friends. After work, all I wanted to do was get home to my own surroundings. Is that common for people with Parkinson's? Dr. Mathur?
Yes, it is common with people with Parkinson's, and it can be for a number of reasons. One is maybe you're a little overwhelmed with your diagnosis. It can be because of apathy. A lot of people with Parkinson's disease experience apathy. It could be the first sign of some other mood issues, such as anxiety, social anxiety, or depression starting up. So it's an important one, and also fatigue, which is a pervasive symptom of Parkinson's disease. So it's an important one because if it's affecting your quality of life, to bring up with your medical team. Because there may be something that they can do that will help alleviate those symptoms, but it is definitely a very common, social isolation is a very common thing in Parkinson's disease, but it's actually one of the things that is one of the poorest contributors to quality of life.
Mm-hmm, for sure. Thank you. The next question, maybe Lydia, if you'd like to answer this. My husband is very sensitive about how others see him. Is there some way he might communicate in a way that preserves his self-respect and loving nature when he's out in public and experiences a slight by another? For instance, someone saying, "You're walking too slow, man." It takes a while for him to respond. This doesn't happen often, but when it does, he's taken totally off guard. What would you suggest to someone who's experiencing that type of a situation?
If I was with your husband, that person would hear about it, but that's, I mean, the things that I would recommend are, I mean, it really depends if your husband is comfortable yet. I think it takes a while to be comfortable with Parkinson's. And my first instinct when I hear that is I would be wearing the "I love someone with Parkinson's" t-shirt right next to this person, so that there's some awareness, but it depends on his comfort level. You know, you might just say, "Hey, go ahead," or you might just say, you know, I have a diagnosis that affects how quickly I go, apologies, like, and make the other person feel kind of bad. You know, but not in a rude way, just be like, you know, I have a diagnosis, if he doesn't want to share. But I think addressing it is fair. I think, you know, saying, "No problem, go ahead. It does take me a little longer, apologies," or something like that. If he doesn't want to explain why, I think in his time, he'll come to be comfortable with it. And for now, it might be on you a little bit just to help him out in those situations. I know I'm the first person to jump up if anything happens with Dad.
Yep, you definitely want to defend those people that you love when
Yeah.
you see that they're not being treated fairly. So thank you. This is a technical question for Brock. So I know earlier you mentioned using an e-bike, and one of the questions is, how do you keep your balance on an e-bike?
Well, my understanding, first of all, I don't have any balance problems right now yet. But my understanding is that people with Parkinson's or people who have balance problems find cycling actually quite good. They're quite able to cycle regardless of the balance problems in their gait. And so cycling is a really good activity for Parkinson's people. In fact, there's a study out of the US that talks about the benefits of spinning as part of it, as where you're getting fast repetitions in your cycle rather than lots of tension on your bike. So it's very good for your gait and your balance. So cycling isn't apparently I don't have a problem with it. I understand it's not a problem generally with Parkinson's people when they cycle.
Great, thank you. So we're just going to wrap up with one more question, and maybe Sonia, if you can answer. What unique challenges do people with young onset Parkinson's experience? What help is there for them to cope with these challenges?
Was that to me, Donna?
Yes.
Okay. The answer to the question again is yes, there are unique challenges that affect people with young onset Parkinson's disease. We often share a lot of similarities with our older counterparts, but because of the age and stage of life in which this disease kind of rears its ugly head, that's what makes it different. So we're often at the height of our careers, for instance, or have young families, or sort of at the top of our earning potential. So these sorts of psychosocial issues become a much more complicated situation for people that develop the disease young and deal with a lot of different stresses, I guess, compared to some of our older counterparts. The other thing is that now we're faced with a real long time, a number of years that we have to live with this disease and live well, try and optimize our quality of life, so that the span that we have to deal with the symptoms is much longer, that we have to plan for is much longer. So these are a couple of things that are very different in terms of where you can get help to cope with these experiences. It's much like for everyone else. There are support groups for young onset patients, either in person or online. You can go to a counselor for help. You have to sort of build your medical team according to what you need. But yes, it is a different life experience, I believe, for people with young onset Parkinson's disease.
Great. Thank you so much. I'd like to thank everyone for attending today's webinar sponsored by MERS Therapeutics, and a very special thank you to today's presenters, Dr. Mathur, Neha Mathur, Brock Carlton, and Lydia Anderson. Your openness while speaking about stigma has surely inspired others to examine how they themselves respond to stigma, and encourage others to educate themselves on how Parkinson's does and does not affect those people who live with it or care for someone with Parkinson's. To learn more about social, institutional, and internalized stigma, how it can negatively impact those who experience it, and what we as individuals and as a community can do about it, I encourage you to visit our stigma webpage. A link to the webpage is going to pop up in the chat window, and it will also be sent to you along with other resources mentioned throughout this presentation, and a link to a recording of this webinar in a follow-up email that we'll send in about a week or so. Our next webinar, Cultivating Wellness, a workshop for care partners, will be a 75-minute Care Partners mental health workshop, and it will take place on Wednesday, June 22nd. So watch your email inboxes for more details and a registration link. On behalf of all of us at Parkinson Canada, I'd like to thank you for joining us, and I hope you enjoy the rest of your day.